You're getting up too many times at night, your stream is slow, or maybe you've even had a scare with almost or perhaps getting caught short before you make it to the toilet. Your urologist or your doctor tells you you've got BPH or an enlarged prostate. But with so many treatments out there, tablets, laser, steam, surgery, how do you know which treatment is right for you? In today's video, I'm going to break it down so you can be better equipped to make that decision. Hi, my name is Dr. Charles Chabert. I'm a urologist and director of the Prostate Clinic located on the Gold Coast in Australia. I've counseled men over the last 20 years with regards to their treatment choices for managing urinary symptoms related to a benign enlarged prostate. As always, if you get benefit from the video, give it a thumbs up, share it, subscribe to the channel. And if you've got comments or questions, please leave them in the comment section down below. Okay, so let's get into it. So what is BPH? BPH stands for Benign Prostatic Hyperplasia. It's the benign enlargement of the prostate. The prostate is usually that small gland that sits underneath the bladder. It's shaped like a donut, and the outlet pipe of the bladder passes through the middle. As we get older, your prostate grows, and it causes urinary symptoms, such as a slower stream, more frequent trips to the toilet, perhaps emergency, or the thing that bothers men to the greatest degree is waking up multiple times at night to go to the toilet. How about this for a stat? Approximately 70% of men by the time they're 70 will have urinary issues related to a benign enlarged prostate. If you've got urinary issues, please leave it in the comment section down below. Okay, step one in this process really is determining your symptoms and your risk. And what I mean by that is, do you have complicated or uncomplicated lower urinary tract symptoms? Complications from an enlarged prostate, complications from a plumbing point of view, is when there is potential risk to your bladder. And we need to consider treating your prostate to prevent that further or future damage to your bladder or your kidneys. If you'd like to be part of our growing community, please follow the link in the comment section down below and sign up to our free newsletter that comes out on a weekly basis, keeping you up to date with all aspects related to prostate health and various treatments that are available for men. Now back to the video. We assess this with an ultrasound, flow tests, and sometimes we do a camera inspection to see what's going on at the lower end of your urinary system. How much do these symptoms bother you? Are they mild? Are they beginning to irritate you? Or are they having a significant impact on your overall quality of life? Certainly, if your symptoms are mild and we think that there is no complication from the plumbing point of view, you don't need any treatment. And it may be that you manage things with simple lifestyle modification. Have one less glass of water in the evening time. Avoid tea or coffee after 5 p.m. or perhaps don't have a beer in the evening. All of these things can make a big difference with regards particularly frequency and urgency. The next step is really to know your options. And there are three main categories of treatment choices. Number one is lifestyle, which I kind of alluded to briefly just then. And that really means reducing fluids in the evening, moderating caffeine, and perhaps retraining your bladder so that you know that following when you've peed, you shouldn't need to pee again for a few hours. There are medications, and the standard medications are alpha blockers. Now, these are smooth muscle relaxants that basically take the pressure off the outlet pipe and make it easier for men to pee. They're reversible. They do come with some side effects, most commonly lightheadedness or a bit of stuffiness to the nose. There are other drugs called 5-alpha reductase inhibitors that can be more effective when people have got larger prostates, but they do run the potential risk of sexual dysfunction, whether that's ejaculatory or erectile dysfunction. Then there are various procedures, and these can kind of broadly be divided into two main categories. The minimally invasive surgical ones, and that includes things like Resume, Urolift, or iTind, or definitive treatments where we create a cavity, such as Greenlight or HOLEP or TURP, or in the case of a very big prostate, a robotic simple prostatectomy. All of these have got pros or cons. Now, here's the crux of the matter. In essence, one size doesn't fit all. And many men who don't have complications from their BPH, but have annoyance from the way that they pee, ask me what my opinion is with regards how we treat things. And whilst it's true that some prostates and some men might be suitable for one treatment, but not the other, where there is a choice, it's not for me to guide that man. It's for a man to prioritize what he's looking for. And really, it comes down to a balance between the magnitude of improvement that someone wants, the durability of the improvement that someone wants, and whether or not they're prepared to accept the risk of ejaculatory changes or potentially erectile dysfunction. So many men say they don't want to be on medication. They don't like taking tablets. They don't want the side effects from tablets. Okay, then maybe a minimally invasive treatment is for you. Some men want a quick recovery, minimal downtime. They want to get back to work and back to their normal activity as soon as possible. Okay, well, maybe Resume or iTind or Urolift is the treatment for you. Then we get down into the nuance of the shape or the size of the prostate, and perhaps that would exclude or preclude that individual from having iTind or Urolift, as those two treatments are less effective in men who have an obstructing median lobe. What about if you have a really big prostate? Say it's between 80 to 100 cc's in size, and you just want definitive therapy. Well, then you should really start looking down the barrel of having either a Greenlight, a HOLEP, or a TURP, depending on the expertise and the service provision that is available locally to you. So as you can see, the choice really depends very much on your prostate size, your prostate shape, and the aspects of a treatment that you are prepared to accept. Many men will not accept the possibility of ejaculatory changes, and therefore they know straight off the bat that they're looking or staring down the barrel of a more minimally invasive treatment, and where they have to compromise is that the potential for requiring an additional treatment within a 5-year period is greater than if they have cavitating surgery. Ultimately, this decision is going to be best made when you have a discussion with your urologist, and he or she can explain to you the pros and cons of these different pathways. But it's really important for you to make it clear to your treating specialist what it is that you want to achieve with a particular treatment. And when you share your concerns with your specialist, then the pair of you can come up with a pathway that's going to be most suitable for you. Unfortunately, there is no holy grail. There is no big improvement in the way that you pee that makes you pee like a 20-year-old again, that's maximally durable and has zero risk to ejaculation, zero risk to erectile function. We can modify our risk to a degree, but there is always a compromise, and that will depend on the nuance of your particular situation. As always, if you've got comments or questions, please leave them in the comments section down below. If you'd like to know more about your prostate, watch this video, or alternatively this one. Until the next time, take care of your prostate.